This is a nice position where you can treat shoulder pain, and that might be anterior, lateral, or posterior shoulder pain. I really like this position for posterior pain in the rotator cuff muscles or in the small intestine Taiyang channel. So you can needle points like stomach 38, or in the Tung system, we can use 77.22, 77.23, which is besides 3 miles. You can use those points as well. And remember that stomach 38 and besides 3 miles, they're on that superficial front line. So those Tung points work very similar to stomach 38. Also in the Tung system, they'll use the 4 flowers, which are like stomach 36 and 37 and 38, but we're needling between the tibialis anterior and the tibia bone in the space. Now, those points, because they're between the muscle and the bone, they have a really strong effect on the connective tissue as well. So we have various points that we can use on the superficial front line that can work with the shoulder. Also, we can use the 77.05, 77.06, 77.07, the 3 weights. So you're going to want to do at least 2 of any of those needles and possibly up to 3. So you could do stomach 38 and then besides 3 miles, or you can also do the lower 3 weights, or you can do 4 flowers. You don't need to do all of them. Typically 2 or 3 points is enough. Now, after you do that, you can have the client move their shoulder. So the first move is just abduction, and then have them do that for, I like to have them do 10 reps. So you can do that 10 times. They're going to do that on their own. And this is just the first movement. So in the balance method and the Tung system, then we're going to have them do the movement while the needles are in. Now notice how this is going to work through the fascial lines as well, because when she's moving here, that's going to move through the fascia and through these fascial lines, and that's going to help to put a little extra sensation on the needles. And sometimes you need to be careful that the movement that they're doing is not too strongly stimulating for the needles. That doesn't happen too often, but for extra sensitive people that may occur. The second move that we're going to want to do is have them do flexion and extension. So they're going to move through this angle, flexion and extension, and then continue to do that. So we're going to be working all the various different types of movements that are possible with the joint, and we're pairing that with the distal needling. Now, what's so incredible about this is that when clients start doing it, often before they get through the second or third set, they're noticing that they have greater range of motion. Often within minutes, they can go from a small degree of movement to a larger degree of movement just by combining the movement with the needles. Now, another exercise that you can do here is we can have them do the circumduction or the shoulder circles. And be careful that they don't move through any areas of pain. You don't want them to move into anything that's painful. And they'll do 10 in one direction and then 10 in the opposite direction. Yep. So those 3 movements, then we had them do abduction and then flexion and extension, and now the shoulder circles and rotations. Those are just 3 movements. I don't like to do any more than 3 movements. Certainly there's more that we can do. However, I find that if you give them more than 3 movements, they forget them. So it's best to just give them a few, let them practice those, and then you can add some more movements in the second or third or follow-up treatments. So that constitutes some of the shoulder movements that you can do with points in the superficial front line, like stomach 38, besides 3 miles, and the lower 3 weights.